This is Dr. Timothy Johnson demonstrating a technique for recycling suture limbs from a knotless suture anchor during an arthroscopic shoulder stabilization. We'll be looking at a right shoulder positioned into the beach chair position with a viewing portal laterally, a 5 o'clock anterior portal, and a 7 o'clock posterior inferior working portal. Here we have a suture lasso being used to pass a nitinol wire around the torn inferior labrum at the 6 o'clock position. A suture retriever is used to retrieve the nitinol wire into the anterior cannula. The nitinol wire is then used to shuttle a blue fiber wire suture around the torn inferior labrum. As seen here, we've already performed a repair of the labrum at the 7 o'clock position using a recycling technique. The suture retriever is then inserted and used to retrieve the passed fiber wire suture into the anterior cannula. From outside the joint, the Arthrex knotless push lock suture anchor is loaded onto the sutures. A drill sleeve is inserted into the joint and positioned at the 5 o'clock position on the glenoid rim, and a drill is used to ream a socket. The anchor is then inserted down the anterior cannula, and with tension applied to the sutures, the labrum is reapproximated to the glenoid. The labrum and the suture are then secured to bone with the assistance of a mallet. Once the anchor has been inserted to the black laser line, the anchor driver is removed. Now, the normal technique for this is to sacrifice the suture limbs at this point, but we will not be cutting these sutures. We will be recycling these sutures for a second pass. The suture retriever is used to retrieve one of those suture limbs into the posterior inferior cannula. A suture lasso is then used to pass a nitinol wire around the anterior band of the inferior glenohumeral ligament, as well as some additionally torn labrum at the 5 o'clock position. The nitinol wire is then retrieved into the posterior inferior cannula. Our recycled suture limb is then shuttled around the labral tissue a second time. With both sutures in the anterior cannula, a knot pusher can then be used to secure the labrum to the glenoid using alternating half hitches. One caveat to using this technique is that these sutures will not slide in the anchor any longer since the anchor is secured to bone at this point, so one must be proficient at tying alternating half hitches to use this technique. However, there are significant advantages. This technique facilitates multiple points of soft tissue fixation using a single loaded knotless suture anchor. It also allows for adjustments in capsular tension after securing the labrum to bone using a single loaded knotless suture anchor. It's rather quick compared to standard double loaded anchors due to the need to only tie one knot instead of two. And the suture management is also easier compared to using standard double-loaded anchors. It's a relatively low-profile construct compared to standard double-loaded anchors, again due to one knot instead of two. And it conserves bone by facilitating more points of soft tissue fixation without the need to insert additional knotless suture anchors.